Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes, and metabolism. Question number 10. For the following case, which of the following should be restricted from this infant's diet? A. Galactose. B. Leucine. C. Methionine. D. Phenylalanine. E. Tyrosine. The case scenario is: a 3-day-old boy is brought to the office due to poor feeding, vomiting, and progressive lethargy. The parents also report that his diapers have a burnt sugar smell differing from their previous children's diapers. The mother and infant were discharged from the hospital yesterday after a normal pregnancy and spontaneous vaginal delivery. The mother is exclusively breastfeeding. Her other 2 children are healthy and have no medical problems. Physical examination shows a lethargic infant with dry mucous membranes and generalized hypertonia. The question is: which of the following should be restricted from this infant's diet? Your options are: A. Galactose. B. Leucine. C. Methionine. D. Phenylalanine. E. Tyrosine. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is leucine. This question is designed with the focus to assess your ability to apply foundational science concepts. This infant has symptoms typical of maple syrup urine disease, an autosomal recessive inborn error of metabolism due to branched-chain alpha-ketoacid dehydrogenase complex deficiency. This enzyme normally allows for the breakdown of leucine, isoleucine, and valine into substrates for entry into the TCA cycle. BCKDC deficiency is neurotoxic primarily due to elevated levels of leucine. Infants present in the first few days of life with progressive irritability, poor feeding, lethargy, and increased muscle tone. The urine characteristically has a sweet, maple syrup odor. Diagnosis can be confirmed by the presence of elevated branched-chain amino acid levels. Therapy consists of dietary restriction of branched-chain amino acids, but patients remain at lifelong risk for neurotoxicity in the setting of intercurrent illnesses and fasting. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. Galactose. Galactosemia is an autosomal recessive disorder due to galactose 1-phosphate uridyl transferase deficiency. The buildup of galactose, normally found in breast milk and regular infant formula, leads to neonatal jaundice, cataracts, hepatomegaly, and frequently Escherichia coli sepsis. Dietary restriction of galactose is the mainstay of treatment. C. Methionine. Homocystinuria is an autosomal recessive disorder marked by a defect in cystathionine beta synthase, resulting in elevated levels of homocysteine and methionine. Restriction of methionine for these patients is one aspect of therapy. D. Phenylalanine. Phenylketonuria is an autosomal recessive disorder characterized by phenylalanine hydroxylase deficiency, leading to hyperphenylaninemia. Untreated patients develop intellectual disability, seizures, decreased hair/skin pigmentation, and a musty odor. E. Tyrosine. Dietary tyrosine restriction may be beneficial for patients with hypertyrosinemia, progressive liver and renal disease, or alkaptonuria, pigmented osteoarthritis. Your take-home message from this question is that maple syrup urine disease classically presents with irritability, dystonia, poor feeding, and a maple syrup sent to the patient's urine within the first few days of life. Dietary restriction of branched-chain amino acids, for example, leucine, isoleucine, valine, is the hallmark of treatment. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.